a few ideas on things where there are potential opportunities for us to improve what we're doing. One is exactly what Assad just brought up, and that is with this cohort of patients who have COVID-19, and really you can extrapolate out to other conditions as well. But specifically for this group, how do you send them home safely and monitor them? And I know Brendan has experience and expertise in telehealth and telemonitor. Our medical center just yesterday had told Maher that we are starting to send people home with oxygen monitors and the ability to remotely monitor them. We already have a monitoring program for heart failure patients. So I don't know if those two things are going to plug in together, but there's definitely an opportunity, because really what we want to do is once somebody's stable is be able to get them out of the hospital. I think it's imperative just from a cost standpoint, but also you don't want somebody who's coronavirus positive in the hospital if you can get them home safely to be on quarantine, because you just make your hospital that much safer by doing so. And if they're ambulating, walking around in their own homes, they're less likely to develop blood clots, which turns out is a big issue with COVID-19 patients. So there's one area where there's a big opportunity. Another one is if we could loosen or give health systems access to one another's data and still maintain patient privacy, there is a tremendous opportunity to rapidly disseminate information and conduct research. Because normally research protocols can take months to years to be done, and they go through a peer review process and hundreds to thousands of patients in a study. What's happening right now is it's physicians talking on chat boards and through Facebook and groups on LinkedIn trying to say, hey, what are you seeing in your hospital? How are you managing patients? Does this medication work? Does that medication work? And really just trying to figure out what's best for the patients. And it's based on anecdotal evidence, one physician talking to another. There was just an article released in JAMA, the Journal of the American Medical Association, which alongside New England Journal of Medicine are probably the two biggest journals in this medical journals in this country. And they were reviewing all of the therapies currently available for COVID-19. And when you look at what's available in terms of actual research, it's really kind of a joke. You have a cohort of 36 patients here that was studied in China and 6 patients in this group. And we're trying to make life and death decisions about patient care on the basis of these tiny numbers of patients about whether a medication might work. It's come up now with this whole hydroxychloroquine thing that our president has been pushing. There's a lot of questions about how beneficial that is and whether it might be, we might be able to use it as prophylaxis to prevent COVID-19 from having serious outcomes with patients. We just don't know. And if you could actually get all these various healthcare systems talking to one another and have the data available and had, I'm not an AI expert by any sense, but had algorithms running to just see, crunch the data and see which groups of, and if you're looking at tens or hundreds of thousands of patients who have COVID-19 and are crunching it, you could actually start to come to some, I think, better conclusions about the best way to treat patients. And it's much better than Assad and me talking with one another and saying, hey, what are you seeing in your medical center? And what am I seeing? And then one other thing, my other thought here, as long as we're talking about data and predictive analytics, on the last phone call we had talked about, if you were actually running algorithms and if healthcare systems, the data was talking to one another and widely available, could you be doing predictive analytics in the background to determine, oh my goodness, in New York City, we're suddenly seeing a lot of patients show up in urgent care centers with fevers that just and catch these blips before they're actually widespread, phenomenon. We might be able to get things under control much more quickly in the future, and whether it's something related to coronavirus or, you could look at sexually transmitted infections or any number of different things and catch the hotspots.